So Henrik Enckell, who is sitting here now, is a psychiatrist and a trained psychoanalyst who works in clinical practice. So he's an adjunct professor of psychotherapy at Aalto University and has published mainly on conceptual research on theories of psychotherapy and psychoanalysis. Henrik's demanding task perhaps is to make a synthesis of the topics discussed in the symposium, but before that, so Anssi wants to continue a little bit more. So about you.
Yes, yeah. So I'm very happy to continue introducing Henrik. So Henrik is I should say one of the key developers of psychoanalytic theory in not only in Finland but in Scandinavia. He's a very central figure in psychoanalytic training and supervision in Finland. The themes of his publications include the theory of metaphor and its implications for understanding the dynamics of mind and clinical processes, as well as dreams and the development of self-observation. For me, Henrik has been a supervisor and a mentor in psychoanalysis, from whom I've learned a lot, and I'm very happy that you will be wrapping up this. So please, Henrik.
Thank you. Can you hear me now? When Mikko and Anssi asked me to give some concluding comments for this symposium, I felt naturally honored and flattered about it, but as I told Anssi, I was also quite horrified about it, because what could I have to say about these subjects in a context like this? But Anssi said that these feelings are perhaps not a bad starting point for making some comments, and I also could join him in that perspective on things. And afterwards, I tried to console myself by thinking that it's perhaps not such a bad idea to ask a psychoanalyst to make these final remarks, because as Arnulf Depperman said earlier today, doing psychotherapy and doing psychoanalysis is trying to help the patient to grasp his or her self. And one could continue that the psychoanalyst tries to grasp the self through the relationship that the patient forms to, especially the analyst. So in clinical practice, we go through the route of relations in order to grasp the reality of the self, and by that I think that we could say that in this work we cover the two main topics that have been discussed during these 2 days. I will first give my picture of some main general lines that I have seen during these two days, some basic models about the self, and after that I will try to make some personal elaborations upon the interconnectedness and the integration between these general dimensions of the self. So first we have the question what the self is. And as Anssi and Mikko said in the introduction to this symposium, that it might be good not to make too fixated definitions upon this subject. And as Dan Zahavi and also Arnulf Depperman had said in their lectures today, that there are lots of different perspectives on what the self is. But I think that there are some general lines or dimensions or models of the self that have been exposed during these days, and that I think maybe some kind of a higher order models of the self, and most of the presentations, pictures of the self may be subsumed under them. And these, in these general lines, I would like to take up two basic models of the self, and both of these models can both be divided into two separate parts. And the first model of the self would be that the self is a bundle of functions, or the self is an agent that uses a bundle of functions. One could perhaps also say that the self in fact is these functions. And through these functions, or with the help of these functions, the self makes a perspective on reality and approaches the world with the help of them. So this could be said to be what Philippe Rochat yesterday called the first person perspective on the self. One could also say that this is the self as a subject or a lived subject with these different implicit or explicit functions. If one would like to describe this self in space metaphors, one could say that this self is the centrifugal self. It goes from a center out to the world. So this would be the first model of the self. And then we have the other one, which can be seen from the other direction. So this would be the self that one makes a picture of when one turns around and looks into the first person perspective. It's a picture of what one sees there. And one could also say that in this model, the self is not a subject, but an object. And if one continues these space metaphors, one could say that this is the centripetal self. And Philippe Rochat yesterday, he said that this is the self from the third person perspective. So these are the first two basic models of the self that I could see during these days. Then the second dimension is what I would like to call the self in the temporal order. First, we have the self as it is displayed today in a contemporary situation. And this self is a display of a certain structure that is more or less fixed. It shows in how the person behaves and relates to the world. And if one may use a concept from linguistics, one could call this the synchronous or the synchronic self. On the side of this, we have the self in development. That would be the self which evolves mainly through interaction with others. That is the self which changes through time. And this could be called the diachronic or the developmental picture of the self. So these are the two basic models that I could see, and they are both divided into these two different parts. Now, the different lectures that we have heard yesterday and today, they use these perspectives in different ways. I would say that some of them use some more and other less, but in many talks we have seen different combinations of all these dimensions. And as Elsa Rönningstam, she was the last one to speak, I would like to use her exposition in order to show how they can be seen in her way of presenting the personality disorders. I think that one can see the diachronic or the developmental perspective as a background model that she uses. The personality disorder is seen as developmental fixation. It is a pathology which is found in persons who have come to a certain stage in development but have not come further than that. So the background of the personality disorder is it's a picture of the self that is in development, but maybe this development may be arrested. And in this arrest, the synchronous picture of the self becomes visible, because these persons, they are fixated in a certain structure, they do not change, they do not learn from their experiences, and due to that, the same structure shows again and again. The first person perspective, or the self as subject, it shows in Elsa's description of the function of the self, how these people, how they have certain functions of self-regulation, for example, or self-reflection, for example. So these are descriptions of how they live their functions as selves. And the third person perspective, the self as an object, it shows in these people's pictures of themselves. For example, when Elsa talked about how self-critical they may be and how ashamed they may feel and how bad they may feel to be. So these are all examples of the third person perspective. Now, I would like to elaborate on these different perspectives on the self and try to make a plea for the relevance or importance of trying to integrate them with each other. And I will do this through using some empirical material that we have heard about both yesterday and today. So, the first example of empirical material is the lecture that we heard by Anssi Peräkylä yesterday. Anssi talked about his research on interviews with people who have borderline or narcissistic personality disorder, and he went into the question of how these people relate to the fact when their stigma, their impulsiveness becomes a topic of the discussion. And he said that he had noted 3 different ways of reacting to the exposure of this stigma, or as it was called, bad behavior that they had. And the first solution by Milla was to acknowledge her bad behavior. She took the stance of the third person, the implicit critic, who would evaluate her and would be of the opinion that that this is a bad thing. So she kind of stepped in to the shoes of the interviewer, which was supposed to be a critical one. So this was the first solution. The second solution was to evade the whole question of impulsiveness and, for example, blame somebody else for the happenings in which it had come forth, kind of saying that it was not my fault, it was somebody else. And the third solution was the defying one, in which the interviewee was kind of proud of doing what she did, and by doing that, she had only the first person perspective. She kind of went into and lived the first person perspective, the self as subject. And one could say that it, in this instance, that it was the solution of shamelessness, and the first solution was the solution of shamefulness. Now, one could say that there are differences between all these 3 solutions, and there naturally are differences between them. But there are also certain similarities between them. And I would now like to take up one similarity. In the first solution, which was the acknowledging one, there Milla, the interviewee, she kind of got into the third person perspective before the interviewer did it. She like went into jail before she had been sentenced there. Or she went into the guillotine before anybody had said that she should go there. So she in fact had the initiative, and in having this initiative, she stayed invulnerable. She didn't take in what Rita Hari yesterday called the second person perspective, what would be what the real other one could say. And the third solution again, in which Milla was defying the potential critic. There, Milla, she stayed in her first person perspective and did not take into consideration and defied the third person perspective. And in the second solution, in which the blame was put on somebody else, there one could say that the interviewee was denying the whole reality of the subject that was talked about. So I would say that what is the similarity of all these solutions is that in none of them both perspectives are there at the same moment. There are not any instances in which there is the first person perspective in which one keeps to it, holds on to the first person perspective, and at the same time takes on the third person perspective, in which the first person perspective is evaluated and looked at and explicated. And I would say that due to this, that there are not a combination of these perspectives, these patients or these persons, they are locked in a certain way of experiencing. So in order to move forward to look into how one could get out of that, I would refer to Melissa Stevanovic's paper today. In Melissa's paper, which was about the self in interaction, and she had three different perspectives on that. It was agency, and then the deontic rights, deontic authority, and the third one was the boundaries between the self and the other one. So in the center of that is the subject of deontic rights and deontic authority, which was or is, as I understood it, it is the claim that one has the right to decide upon what will be done. And she described how this question was negotiated in interaction. Now, if we go to the persons that were described by Elsa and by Anssi yesterday, I would say that that for these people, if one would look into them with this perspective of deontic right and deontic authority, I suspect that this question would be would be very, very, very relevant, and one could see that they are specifically claiming some rights to be, for example, handled in certain ways or getting certain responses from the other one. So they are trying to keep the power or the right to have that kind of a response from the other one. Now, Melissa also described agency and the boundaries. I will only now go into the question of agency, which was, as I understood it, the agency is the measure of the person, how much he or she engages in the situation, in the interaction, and mostly of all in the other person, in the other person's perspective, and in the other way, in the other person's way of relating to me. So Melissa came to the conclusion that if one engages in the other one, then the claim to deontic right, that is, the claim to have the right to be an authority of what we should do, that claim suffers. Which means that if you get engaged in the other one, in the perspective of the other one, you take the risk of losing the authority that you have, which of course is something that can make one afraid. So I would say that the combination of these two, through this engagement, there is an opening up from the closed structure of these persons that Elsa and Anssi have been describing. They are not so stuck if they give up these deontic rights. Now, how can this be done? And in order to have a look into that, I would like to refer to Arnulf Deppermann's paper earlier this afternoon. Arnulf looked into how therapists may use the biographical self in psychotherapy with patients. And he had certain questions there, at which points this resource is taken on, and how the thing is elaborated upon in the continuing therapy. He said that the therapists, they may see this biographical self, which I believe is, or it comes at least close to the third person perspective. It's a picture of the first person perspective, or what Arnulf said, the performative self. So when the patients, when they are talking about their contemporary experiences, then and by that living their first person perspective, at that moment the therapist may use the third person perspective and supply a picture of the historical self, or the biographical self. And I would suggest that this picture that the therapist supplies is a metaphor. It's a metaphor through which the therapist tries to help the patient get a grasp of the experience that he is having or she is having in the here and now. So the past self, the biographical self, is used as a perspective on today, today's first person perspective. And in doing this, the therapist is engaging in the patient's perspective. He's engaging in it, giving a picture, and by giving this picture is inviting the patient to elaborate on this picture, and is also supplying an understanding of the patient's experience. And through that experience, the patient may also become involved in and engaged in the therapist's perspective. And I think that through this, a process may set going through which the patient may become the self that he or she is not yet, but may become, and through that may become more fully his or her self. Thank you.